Hello, Senator Lewis. My name is Jessica Thomas, and I am a nurse as well as a healthcare advocate. And today I am here to discuss a critical issue that is affecting many Americans with the urgent need to expand access to telehealth, to reach that equitable access to care, health equity. And as you know, telehealth has been shown to help many different areas of healthcare, especially ever since the pandemic in 2019 with COVID. And in this presentation, I would be identifying the problem. I would talk about the data and impact that is associated with telehealth disparities, as well as providing solutions to policymakers for them to correct this issue or attempt to correct this issue. Let's begin by clearly defining the challenge. And our chosen healthcare policy issue here is addressing the persistent healthcare access gaps across the United States, especially with COVID-19, especially with telehealth. There are persistent gaps in healthcare access, and this tends to threaten the well-being of millions, whether it be rural, low income, elderly, and chronically ill populations. They are highly affected, especially those with chronic comorbidities. The rapid expansion of telehealth during the COVID-19 pandemic helped to showcase its potential, but with emerging policies ending, it is crucial to ensure there is a continued access and equity for all patients. So this is basically stating the issue that is currently at hand. There are different minorities or groups of people that are not having access to this valuable approach to healthcare, and they're the ones that actually tend to need it the most. The CMS can play a vital role in expanding telehealth access for Medicaid or Medicare beneficiaries, particularly during the COVID-19 public health emergency. And while these policies increase the utilization and continuity of care, evidence has shown that access remains uneven. There's research that has been done that has showed that older adults, rural residents, low-income beneficiaries, and racial and ethnic minorities continue to face barriers related to broadband access, device availability, and digital literacy. And as a steward of Medicare and Medicaid, the Center of Medicaid Services is uniquely positioned to be able to address the inequities through targeted reimbursements and regulatory strategies. So defining the problem, the complexity of telehealth policies across different payers and states. The telehealth policies in the US are fragmented and inconsistent, leading to significant barriers in access, and these variation in coverages by payer and states can tend to create confusion for both the providers and the patients, and this will in turn prevent effective utilization of telehealth services. And with this uneven landscape, it can hamper the goal or limit the goal of equitable healthcare access for all populations. The research that has been done has shown that there is a digital literacy that limits telehealth use, as well as structural inequities that affect the utilization. Research demonstrates that the digital divide significantly impacts telehealth use among Medicare beneficiaries. Kyra is one of the researchers in 2019 that found that communities with limited broadband infrastructure experience lower telehealth utilization even when services are covered. For many Medicare beneficiaries, especially older adults, the barrier is not willingness to use telehealth, but rather the lack of resources and support to do so effectively and adequately. So now we're going to look at the data and impact of telehealth across different bodies of people, across different healthcare facilities, and across over time as well. Telehealth significantly enhances healthcare access and quality for patients. The expansion of telehealth has led to increased access to both primary and specialty care, improving the management of chronic diseases and reducing unnecessary emergency visits. However, without a targeted policy support there from policymakers, there is a risk of widening disparities for vulnerable populations like the elderly or the low income. Addressing these challenges is critical for sustained healthcare equity. So this is basically telling us the impact that telehealth has on the quality of care, which it increases, and the access also helps to improve when coverage is expanded. The recent evidence directly relevant to CMS policy decisions has shown that telehealth expansion can improve access without compromising the quality of care. Researchers in 2024 were able to find that expanded telehealth coverages for Medicare beneficiaries were associated with improved access and maintained quality outcomes. Here we can see that in an FCC survey showed that about 72% of respondents said that they use the internet to schedule or attend telehealth appointments. So those that don't have access to internet or don't have that digital literacy are at risk. 1 in 6 households across the country also rely on the ACP. More than 3/4 of respondents to an FCC survey said that the end of the ACP would either disrupt or end their internet access entirely, while others said that they would take money from other bills or cut other expenses like food and gas in order to pay for their internet. So what is our proposed policy solution to combat the issues that we're having with the disparities in telehealth? One, we want to expand Medicare telehealth coverage for enhanced access and equity. You also want to remove the geographic restrictions and originating site limitations for services, as well as standardize Medicaid by harmonizing reimbursement policies to promote equitable access. You want to do this by incentivizing equitable telehealth delivery and supporting digital literacy and access. I am proposing that the CMS adopt an equity-centered telehealth framework that includes the reimbursement incentives for providers serving high need and digitally underserved populations. I'm also proposing that they support for digital literacy programs and device access partnerships, as well as required equity metrics in telehealth reporting. Research by Chai in 2025 has shown that emphasis on telehealth can promote health equity when infrastructure, education, and policy alignments work together. Now, to speak on the effectiveness and the feasibility, you want to leverage existing infrastructure for sustainable telehealth solutions. The proposed policy builds on the strong foundation established by the CMS during the pandemic already. And by utilizing existing telehealth infrastructure and resources, we can ensure a scalable and effective expansion of services. This strategy emphasizes both practicality and resilience, enabling healthcare providers to meet diverse patient needs across settings. This approach is feasible within the CMS existing regulatory and reimbursement authorities. Equity-centered telehealth aligns with the CMS strategic priorities and goals, including value-based care, improved access, and health equity. Evidence from research shows that reducing digital barriers can lower the avoidable utilization. It can also improve chronic disease management and enhance patient satisfaction, which will help support both the quality and the goal of cost efficiency. A few ethical considerations to take into account is promoting health equity and social justice in telehealth access. Providing this access to the people that need it will help to promote health equity and also promote social justice, which are ethical policies or ethical considerations that should be taken into account. Expanding telehealth services will help to advance health equity by breaking down the barriers to care for marginalized communities. By ensuring that telehealth is accessible and culturally responsive, we can support patient autonomy and informed choice, which will ultimately foster social justice and improve healthcare outcomes. Lastly, This is our call to action. We want to make sure that we're urging CMS leadership to ensure telehealth access and equity. The time is now for CMS leadership to act decisively. Are things going to change or are things going to remain the same? By sustaining the gains made during the pandemic and implementing permanent telehealth policies, we can ensure access to quality healthcare for all, particularly the underserved. This proactive stance will foster equity, stability, and resilience within our healthcare system. And these are my references.